So what I'm going to talk to you a little bit about today is the Alabama trauma system. It seems that there's not a lot of knowledge about this in the general medical community of the state. So hopefully you'll have a little bit better idea of how the trauma system works in Alabama. So those are my disclosures. I don't have anything that conflicts with this talk, though. So the Alabama trauma system. Alabama has a statewide trauma system, for those of you who don't know. It's made up of hospitals. It's a voluntary system, so hospitals decide whether or not they want to be in the trauma system, but all hospitals are invited to participate in it. The participating hospitals are designated as levels 1, 2, or 3 through the state of Alabama, through the Alabama Department of Public Health, and their level of hospital designation is really dependent upon their resources and their service availability. Hospitals are inspected, so the Alabama Department of Public Health comes in with a team. I've been a member of that team and have looked at different hospitals, and we verify that the hospital can actually provide the level of care for which they have applied. Also, it involves having surgeons that want to do this, having the subspecialty groups that want to participate in this as well. I'm going to talk about this in a minute, but Alabama is one of the only states, I think it is the only state right now in all of the United States that actually has one central location that can actually monitor the resources throughout the entire trauma system for the entire state of Alabama. There's a lot of places that do it for various regions in their different states, but Alabama does it for the entire state. Okay, so obviously a map of Alabama. As you can see, the trauma system is broken up into 6 groups. Let's see if I can pointer here. So it's a little hard for me to see over here, but you have 1, 2, 3, 4, 5, and 6. Within the state, we have actually 3 level 1 trauma systems, or 4 level 1 trauma centers. We have Huntsville Hospital up in Madison County. We have UAB, of course, in Jefferson County. Children's Hospital of Alabama is the only verified level 1 pediatric hospital in the state. And then, of course, we have the University of South Alabama down in Mobile. All of these are state-verified level 1 centers with Children's and UAB being American College of Surgeons verified level 1 centers as well. We also have 2 level 1 hospitals that patients are referred to outside of the state. This is Erlanger up in Chattanooga, and this is Sacred Heart down in Pensacola. And actually, I think Sacred Heart may have just bumped down to a level 2 here recently, but it is also within the state's trauma system. As far as level 2 hospitals are concerned, you have a hospital here in Montgomery that is Baptist South. That's the level 2 facility, as well as a hospital down in Dothan. So those are the only 2 level 2s within the state. There are 2 level 2s outside of the state, one in Mississippi, and then Baptist Hospital in Pensacola is a level 2 for Florida and for Alabama. And then we have a number of level 3 facilities. There are 11 in District 1, 8 in 2, 7 in 3. There are 2 level 3s in 4. That would be see, it's DCH, and I'm not sure which hospital that is up there in Marion County. Do you know? I don't know either. And then there are 11 in 5, District 5, and then 11 in the Mobile region, for a total of 50 level 3 hospitals. And then there are various numbers of community hospitals which represent the other dots in the along the map. So as I was saying, Alabama is one of the only states that can constantly monitor the capabilities of every trauma hospital. And so therefore the idea is that it can route the patients to the right place every single time. And this is done at the Alabama Trauma Communication Center, which is actually here in Birmingham. It's located on UAB's campus. It's staffed 24/7, 365 by 3 paramedics that take incoming calls. So there's a paramedic there. He's answering the phone. And what you see is that he has this computer screen in front of him. This is kind of one of the outdated looking shots of it. But essentially what you have is that you have the hospitals listed over here on your far left. And it has their verifications. So as you can see, University Hospital, I can't quite make it out over here, but University Hospital has a 1 in that green box. That means that it's the level 1 facility. If you see a 3, it's a level 3 facility. Green means go, red means they're not ready to go, okay? Up at the top, you see T, S, and C, and this is actually all filled out now. That the Trauma Communication Center also routes patients for acute strokes and acute MIs to get them to the right hospital. So if a hospital is capable of taking care of a stroke patient, acute stroke patient, or a cardiac patient, they're also would have a box that's red or green if they're ready to go. And basically everything that makes a hospital red or green is listed up here at the top. You have EDT, which is whether or not trauma's ready to go. ED is whether or not the ED is on diversion or not. Anesthesia, or ANES, is whether or not they have an anesthesia provider. OR, if the OR is capable. X-ray, if X-ray is capable. You get the picture. ICU. TS is trauma surgeon. SS is secondary surgeon. OS is orthopedic surgeon. NS is neurosurgeon. CT is a CT scanner, whether or not the CT scanners are up or not. And then SICU is if they have a surgical intensive care unit, whether it's open and available. Neuro is for a neurologist for the stroke patients. And then you can see the other 2 at the end would be for cardiac patients. Okay. So the way that patients are enrolled into the trauma system rather, is that basically EMS picks up the phone, the radio, whatever they have, and they contact the trauma communication system. And that's it. If they do that, the patient's enrolled into the system. And then the TCC will direct the medics to bring the patient to the closest, most appropriate hospital based on whether they meet certain physiological criteria or certain mechanistic criteria. The other way that patients can get enrolled into the trauma system, say they show up at a community hospital, is that the ED staff just has to pick up the phone and call the TCC, and the patient will be put into the system, and then the TCC will help figure out where that patient needs to go from that point if that hospital is not capable of caring for the patient. There is a QI process that's associated with the trauma system. It involves EMS, it involves the hospitals and physicians, and it involves the communication system as well, so that if there's a problem, if a patient goes somewhere that they're not supposed to go, or if there's a transfer that's not appropriate, they get to talk about it and figure out what happened, and then there's some feedback to the providers or the individuals that were responsible for the quality issue. So with that, that's a very brief tour of the Alabama trauma system.